Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, everyone. Hope you're well. Welcome to CATHIP's Health Hour. My name is Dr. Vanessa Rapia, and I'm your host this morning. And as always, we've got a fantastic morning planned for you. So just a reminder of CATHIP and who we are. So in terms of CATHIP, we are a group and organizations that have come together to really think about how we can empower our communities in terms of health so that we can take control of our health and also support others within our lives. So it's a partnership between CAHN, the Caribbean and African Health Network, it's RAFA, it's Croydon BME Forum, Enfield Caribbean Association, the Black Health Initiative, and also the Redeemed Christian Church of God Sheffield branch. So we're really honored to have you here with us this morning and every Saturday morning, actually, because we don't take it lightly that you take your Saturday mornings to spend with us. And just to emphasize that these sessions are for you. So this morning, it is my complete pleasure to welcome Dr. Anyabolu, who is going to be talking to us about rhinitis and also managing some other respiratory conditions such as asthma. And I know that it's so relevant to all our lives. And we're really honored to have her here to share her knowledge and also for us to have an opportunity to ask any questions that we may have. So before I hand over, just to remind you that we have the chat. As ever, through COVID, we've become used to online platforms. So please use the question and answer element within the chat just to give your questions, and I'll do my best to channel that through. Also, we've got viewers on Facebook as well and YouTube, and our team at CAHN here are doing fantastic work behind the scenes to make sure that we bring them forward. And we'll also be interacting with you on the chat function because as ever, we want to hear from you and learn about how we can do better. So that's it from me, and I'm going to hand over to Dr. Anyabolu to take over. So thank you and welcome.
Thank you ever so much, Vanessa, for the lovely introduction. It is, I feel honored to have been invited once again to come and be part of the CAT Hour. And it's one of those things that it's fulfilling to be part of this project that you guys are doing. So thank you for inviting me. Hello, everybody. My name is Nkolika. And I will go ahead and share my screen with you. Can you see my screen, Vanessa?
I can, and perfect, on full screen, all gone really well.
Fantastic. So my name is Nkolika. I'm a GP in Dorset in the south of England. I'm also a GP trainer, and I'm a program director for the Mid-Wessex GP education. I have a very keen interest in education. I'm originally from Nigeria, and I obtained my primary medical qualification from Nigeria. So I'm well aware of the issues that we can face when we come to the UK with regards to infections and obviously the health inequalities that exist. So it is today I'll be talking to you about rhinitis. It is a very, very, very medical term, but it just simply the lots of things that lots of people go through, especially at this time of the year when it's really, really hot. I don't know about you, but it's boiling hot down here where I am. So I'll go ahead and tell you, what is rhinitis? You know, rhinitis it's described as a reaction that occurs that causes the inside of our nose to become irritated. And when that happens, you know, lots of people develop blocked or runny nose, and they can even start sneezing and itching. So this picture just shows you how the inside of our nose is. It's not always this red and angry looking, but it's normally very, it looks less swollen and is ridged like this. But in a situation where it becomes inflamed, this is what happens. It becomes very red, becomes swollen, and there are lots of discharge. And this is what leads to that blocked nose that lots of people experience. Then also, obviously, I'm sure lots of you have had situations where you sneeze a lot. So it's all part of that. So there are different types of rhinitis. When we talk about rhinitis, there are different types. There is the infective one, where one has developed, let's say, a bacterial infection that requires antibiotics. There is also the allergic one, and this happens when you are exposed to something your body just doesn't like, and that's what we call an allergen. And the allergic type can happen all year round because there are different types of allergens. There are so many things that our bodies are exposed to that oftentimes just doesn't agree with. Then there is a non-allergic type. And the non-allergic type can be due to drugs. I have put ibuprofen because that's one of the commonest medications that lots of people can get over the counter. It can also be caused by aspirin. And for those who use recreational drugs, some like cocaine, it can also cause rhinitis. Then another common cause is, you know, you have a blocked nose, you're not able to breathe. Lots of people go to the pharmacy or even get a nasal decongestant over the counter and use it for such a long time that it starts to cause the problem you're using it to treat. So it's important to be aware that these medications can inadvertently cause or worsen the problem that you're already trying to treat. Then there is also the hormonal component to the rhinitis. That's why women who are pregnant, or those who are on HRT, which is hormone replacement therapy, or those who are using contraceptive pills, find that when they start these medications, they start to have blocked nose and find it difficult breathing, and the nose starts to itch. Hay fever. I'm pretty sure lots of people have heard the word hay fever, but it's important to bear in mind that hay fever is a very common problem, and it occurs at particular times of the year. It's also known as seasonal rhinitis. And I've put a picture there of a bee who's covered in pollen. So when we talk about pollen is just, it's like dust. You can't actually see it because it's like dust. And between late March and September, this time of year is perfect for increased pollens in the atmosphere. So this is the time that lots of people do start struggling with hay fever. And it can affect both adults and children. As a GP, this is a time that lots of people start to make requests for medications and they tell you that they usually use these medications at this time of the year because they generally struggle with hay fever. So what are the symptoms of rhinitis, hay fever, and the rest of it? So the symptoms, like we've said before, is sneezing, is an itchy nose. You get a runny and blocked nose. Your eyes start to itch and then they start to water. Sometimes you develop a cough and the roof of your mouth becomes quite itchy as well. I remember back in Nigeria, when I was in secondary school, I studied in Enugu in Nigeria. Nigeria is full of dust, brown dust, isn't it? So I remember that any time I was exposed to any sort of dust whatsoever, I will spend the next 30 minutes itching, coughing, my eyes will swell up. And it was because I just was so allergic to dust. And ever since I've been in the UK, that hasn't been a problem for me, thankfully. But these reactions can happen within minutes of coming in contact with whatever it is that you're allergic to. I've also put some pictures just to lay some emphasis on the symptoms that we've talked about. So what are the triggers? Vanessa, I'm going to put you on the spot here.
I'm ready.
Have you had have you struggled with hay fever or had any symptoms in keeping with rhinitis?
So I actually have very bad rhinitis. So yes, yeah, and it's really intrusive. And you know, each morning, if I get up and I can feel, you know, the throat and your nose and the runny nose and the sneezing, but obviously I have the anxiety, is it COVID? So I end up testing all the time just because you're not sure. And sore throat is a common symptom of COVID at the moment. So yes, yeah.
Yeah, COVID has muddied the waters a lot now, hasn't it? Anything now, any snuffle, any cough, oh, is it COVID? Is it COVID? Is it COVID? But we forget that there have been lots and lots of viruses in existence long before COVID hit the shore. But COVID being what it is, it's taken over the news, hasn't it?
Exactly.
Yeah, so hay fever is a very common problem. And apart from pollen, what are the triggers? You know, I've mentioned dust. In my case, dust is a trigger for me. And there are other triggers, you know, a change in temperature. They say you go from a hot room to a cold one, or vice versa. That can trigger a rhinitis, you know, where you find your nose start to water. Exercise can also do that. Then we've talked about then chemical irritants can also do that in terms of, again, I once had a friend who, anytime she comes into a room where there's perfume or any spray, aerosol whatsoever, she just starts sneezing and coughing and the whole place starts to itch and her eyes go red. Then we've talked about pollen from trees, grass, and weeds. Then animals, you know, dogs and cats. My boy, I've got a set of twins, a boy and a girl. And where we live, we've got stray cats. I won't call them stray cats, but they're cats that belong to homes. But they always leave their house and they come around our garden. And we had this very friendly cat who my kids got so used to. But unfortunately, after the first and second and third exposure to this cat, my boy's eyes swelled up. He started coughing, he started itching, he was just itching the whole body. And unfortunately, we had to say bye-bye to the cat. So we stopped feeding it and thankfully it stopped turning up. So cats and dogs can be a trigger. Then mold. Mold is a common problem in the UK, isn't it? Especially in the winter months. Because we're trying to, especially now that the cost of heating has gone up, lots of people are going to open their windows even less. So that means the molds will now take hold in very damp areas. So it's a common cause of a rhinitis and allergy type symptoms, and even asthma. It can make asthma symptoms worse. So again, part of my role as a GP is that when people are starting to struggle with these symptoms or are requesting more of the medication than they should be requesting, my role is to try and find out, is there any trigger that they are not aware of that may well be making things worse for them? Because there's no point continuing to treat and pour medication at something if you're constantly being exposed to the trigger. And I must say that on quite a few occasions, it turned out that the house they were living in was very moldy. And when they dealt with that, their symptoms improved. So it's something to be well aware of. Then obviously wood dust, floor dust, and latex. Again, it's important to be aware that oftentimes allergy can run in families. So if anyone, if anyone in the family has a history of asthma or eczema, then it's most likely that you may struggle with any allergy type problems. Again, in my family, my sister doesn't wear anything that is not gold, because if it touches her skin, she just breaks out in a rash and becomes very, very itchy. So in my case, unfortunately, atopy runs in my family. Then I was also going to touch on sinusitis. Please do hit us with any questions, and don't let me rattle through. I did warn Vanessa that I have a habit of finishing early, because I would just talk through. But it's always helpful if you guys can engage and let us know any questions you have.
Great. So no other questions have come through at the moment. So I think, but as soon as any others do, I'll interject as well. Definitely.
Yeah, of course. So I was going to touch on sinusitis. So again, the sinusitis is a very medical term. So sinusitis just means inflammation of the sinuses. So the question is, what are sinuses? So sinuses, the way I explain to patients or to people that I'm trying to teach is that our head is not a big solid block of bone. It's not. So apart from the space where the brain needs to stay, our head has been designed in such a way that the bone has some spaces in it, and those spaces help to allow for air movement all through the bones. And there are 4 of these air pockets, and these air pockets are what we call sinuses. So I've put up this picture just to show you where the sinuses are. So you've got 2 just above your eyebrow. Then you've got another 2 just in the inner part of your eyes. Then there's also another sinus that is hidden behind the nose, as they call it. It's hidden behind the nose. And the biggest of the sinuses is just under your eyes, around the cheek. So sinusitis, ideally, like I said earlier, these are air pockets. So there's not meant to be anything in this spaces. But due to inflammation or infection or even rhinitis that is not treated, it can lead to these spaces becoming bunged up and clogged up with lots of gunk. So when that happens, lots of people can develop, again, the symptoms of rhinitis, where the nose blocks up. They have pain in their faces, especially when you touch the face, it's quite sore. And some can develop a fever, and some become very irritable. And when it's really bad, lots of people feel really, really rotten in themselves. Another thing another symptom is that when you blow your nose, you get lots of gunky, manky stuff that comes out from your nose. And it's simply because these 2 big sinuses here open up to the sides of our nose. So when it's filled up with lots of gunk, it comes out and literally exudes out. So that is what sinusitis is. And as we can see, it's connected to the nose. So if you have like a simple hay fever type symptom that is not treated quickly and early enough, it can lead to something much bigger, which is sinusitis. And when we talk about sinusitis, there is the acute one that happens, then goes. then there are people who, unfortunately, they are prone to this sinusitis. So it happens over and over and over and over and over again. That's when it's now called the chronic sinusitis. And again, looking at the picture on the left, it's on my right, my screen, where it's all bunged up with lots of manky fluid in the sinuses. What happens is that when you now lie down, when people lie down, this fluid now trickles backwards. It trickles backwards down the throat and can get into the lungs. And that's what leads to chest infections. So again, when people present with a cough or worsening of their asthma or just not feeling right, oftentimes it may well be sinusitis that is the problem.
No, thank you so much. And I think people are, when you're describing it, people are thinking, gosh, this is what happens to me, or how have I experienced it? And there's a question that's come through that said that at times the person finds that only one eye is affected and waters, and to the extent that they can't be sure, but is this quite common that it can be one eye rather than both?
Well, one thing to be aware of is that one can never say never in medicine.
Yeah.
So in some people, it affects both eyes and both nostrils, but in others, it can be just one. Mm-hmm. So the other thing to also bear in mind is that there is really no test for hay fever. What can be tested for is maybe to find whatever it is you're allergic to. So if you're concerned as to whether it is actually hay fever or anything to do with allergy, then it's just really best to get it checked out. Mm-hmm. and speak to your GP, because apart from allergic rhinitis and atopy and all the things that could affect the eye and could make the eye water. So it's important to bear that in mind.
That's great. Well, questions are coming through thick and fast, but I'll let you continue because we've got time at the end as well. So
no worries. I hope this picture on the right is not too scary. I was going to make it come towards the screen and go back, but I felt it was going to scare people, so I've left it. But yes, it's good to have a picture or representation of what it is that we're talking about, because this is exactly what it is. My late father was an ENT surgeon. And what he specialized in was really ear, nose, and throat. So for people, and I remember growing up, he was always going to theater, and he was every now and again telling me about, what he did in theater and his patients. And I do remember coming across quite a few of his patients that struggle with sinusitis, chronic sinusitis, to the point that they needed to go into theater to have it washed out. So that is sinusitis. So let's talk about treatment. The treatment for sinusitis, rhinitis, hay fever, it's really all the same. So it often gets better on its own. So it doesn't necessarily need treatment, but sometimes it can linger for longer than it should be. Or oftentimes it can be very, very irritating. People become irritable and you start to affect you. That's when it's important to, again, go to the pharmacy, get some antihistamines that are very common over the counter. There are also some nose sprays. Remember the first picture we showed you where it was all swollen and red and really manky? These sprays help to reduce those swelling and the inflammation. So it's important, again, to bear in mind that it should not be used for children who are under 6. Another thing that is also helpful is salt water sprays and solutions to just rinse out the inside of your nose. Remember we talked about the pollen, and I showed you that picture of the bee that was coated in this pollen. So that's the way pollen, spreads. It just touches onto surfaces and just coats those surfaces. So this saltwater spray helps to rinse it out. And then the nasal barrier palm. So it just spreads around your nose, and it serves like a sellotape that just glues onto the spores and prevents it from getting into your nose. Then obviously we've talked about skin wipes, just to make sure that the allergens are wiped away. Sorry. Then we've got saline nasal, saline simply means it's salty water and eye drops, again, just to irrigate the eye. Then the nasal irrigation with saline is something, I've put a picture. This is something I almost always recommend to all my patients who come to me with sinusitis and struggling with it. So this is something that ENT, the ENT team generally recommend, and you can get it easily over the counter and from Amazon. It's just a big bottle that has salty water in it. So what I tell my patients is buy it, put your one nostril over the nozzle and squirt it. So remember, if we go back to this photo, remember that these big sinuses open out to the nose. So when you squirt it into your nose, it goes into the sinuses and washes it out for you. So that's another way of preventing this fluid and this exudates from building up in your sinuses. Vanessa, have you used it before, or do you recommend it?
My face revealed it. Yes, I have, and I think it's fantastic. That it's the thought of using it, and you know, in the way that you showed you were saying about the picture, it sometimes makes you feel a bit uncomfortable, but it's a really good product, I found, and made a real difference. But I'm just not good at using it regularly. Yeah.
Fantastic. So I guess the question is, why is it important to treat allergic rhinitis? It's important because if it's left untreated, it can lead now to more severe infections. So we've talked about the sinuses, we've talked about sinusitis. It can also lead to infection of the eyes, conjunctivitis. And that's now what leads to you needing to get hold of a doctor or go to hospital, because it goes from something simple to something more serious. The other reason is it can lead to worsening asthma symptoms. Obviously, this talk is about upper respiratory tract infections, but again, we're also touching on asthma. So when rhinitis or anything to do with the upper airway, when it's not treated, it can lead to increased tightening of the chest. The airways will now swell up. The cough gets worse. People become more wheezy. And we know that asthma can be fatal. So it's important that when you develop these symptoms or you develop rhinitis, it's important to get it treated very quickly, especially if you've got asthma. Then it's also, the NHS tells us that, you know, when it's not treated, it's a risk factor for developing asthma, especially when you're from a family where there's allergy. So again, another good reason to treat it, especially in children. Then what I find is that it can have a huge impact on people's lives. I have had patients who are literally crippled with their rhinitis and with their hay fever. They tell you, I can't function because it is so bad. So it can be very debilitating. And that can lead to people feeling really low in themselves. They are less productive and can lead to mental health issues. So these are just a few of the reasons as to why it's important to treat it. So we've talked about going to your pharmacy to get some antihistamines. We've talked about using some nasal decongestants. We've talked about the saline, the salt water wash, where it washes out your nostrils. We talked about the wipes and talked about all that. So when do you need to contact your GP? Obviously, as a GP, what we always preach is try and treat it yourself. If it doesn't work, then you need to know when to get in touch with us. So these are the lists. These are the reasons why you need to get in touch with your GP. When the symptoms are getting worse. We've talked about non-allergic rhinitis, when you're exposed, when it's caused by medications or it's caused by exposure to fumes or cocaine or anything like that. So when it's not getting any better, is when to contact your GP. And again, if you've got asthma, we've talked about it before, when your asthma symptoms are getting worse, you're using your inhalers, you're using your usual asthma medications, and it's just not improving, that is the time to get in touch with your GP. Then we've also talked about how it can affect people's productivity and their mental health and their ability to go about doing their daily activities. Then for the participant that asks about one eye that is watering, this is it. When it's not clear as to what exactly is going on, that is the time to get checked out. Then obviously when all these other treatments that you've been given is just not working, you've been to the pharmacist the first time, the second time, the third time, it's just not working, that is the time to get in touch with us, because we can now prescribe a stronger type of antihistamine, and we can now prescribe some maybe antibiotics. Another one that we generally use is steroid spray that you can spray into the nose, and that helps to reduce the swelling, the inflammation, and all that's going on. There is also an antihistamine that is used in the nose, and that's perfect when you've also got eye symptoms and nose symptoms as well. But these are only obtained via prescription. So these are the reasons to get in touch. And we've come to the end of our talk. And these are just a few links. I'm pretty sure, Vanessa, will the attendees get these resources, or is it going to be online?
Definitely. So people can email, and we'll put the email in the chat to receive it directly. But yes, the beauty of this is that it is on YouTube, it is on Facebook, and people can go back and talk about it even further and review it themselves. So that's great. And I think thank you so much, because I think it's given a great platform of clarity and learning, and the questions are coming through thick and fast, and I'm sure as we mentioned, there may be other things related to rhinitis that people will want to bring up and discuss, and I know that you're the perfect person to ask, so that's great. So one of the things that I think people which is great, are directing it to their own experience or the experience of their family members. And one of the questions was whether the use of eye drops is appropriate for a child when they have hay fever as well, because I know that I'm seeing my children experiencing symptoms of hay fever as well. And so just trying to think about what's the best way to manage it in children.
Well, again, it's always good to err on the side of caution. So before buying anything over the counter for any child, you must speak to a pharmacist, because certain medications can't be used for certain age groups. So when we say children, remember, children, it ranges from a newborn to a 17-year-old. So the age range is massive, and what can be used for each and every one of them is different. Yeah. So yes, depending on the age, you can use antihistamine eye drops. Mm-hmm. I have used it for my boy, and you can also use just oral antihistamines. Mm-hmm. It comes in syrups and it comes in tablets as well. But it's always best to speak to a pharmacist just to be sure that you're doing the right thing.
Great. Okay. Thank you. And again, I think the sinus, there's quite a few questions about the sinuses, which is great. And one of them, it just talks about some of the symptoms that happen. So just talking through that when the sinus is blocked, they can't blow their nose. And someone else privately has said that that's the most uncomfortable thing. So what do you suggest about that?
So the easiest thing you can do is get a bowl, put some hot water in it, boiling hot water. Obviously, be very careful not to scald yourself. Then you get some a balm. It's called mentholatum balm, menthol. Put some into the water, then get a towel, put it over your head, then put your head over that water and inhale the steam. Make sure you open your mouth and inhale the steam. The steam will go through your mouth and through your nose. That is a very effective way of helping to reduce this nasal blockage. The other thing you can do is obviously go to the pharmacist and ask for a nasal decongestant. So we talked about nasal decongestants. If you use them for too long, they can now cause what we call, it's a big medical word for it, rhinitis medicamentosa. It's just a big word that it now causes a worsening of this blockage that you're using it to treat. So the bottom line is that you need to use it for a very short period of time, about 5 to 7 days, and avoid using it for longer. So these are very powerful and are very, very effective. The commonest one that I have used ever since I've been a child is when I've been young, is Otrivin, and you can get it over the counter. They come as sprays, they come as drops, and I think these are the two forms, sprays and drops. So these are very effective. They usually open up the nose almost instantly. Then obviously, if these don't work, then speak to your GP, because that's where we now go for this steroids I told you about. There are different forms and different strengths of steroid sprays that can be used in the nose to try and open it up.
Great, thank you so much. I think that will be really, really helpful for many people. And it's the kind of the steam inhalation is something that many of us have grown up with, handed down, do that steam. And sometimes some of the simplest things are the best things to give you control. So no, that's great. Thank you. And related to that is about sinusitis and headaches. So there's been a couple of reflections about the headaches that come with that. And Angela specifically asked, is it hereditary as well? Because she can name a number of people within her family that have it as well. So if you could comment on that, please.
So if you remember, we talked about atopy. Atopy is just allergy that runs in families. So we talked about it, that it can be hereditary. So remember that sinusitis, it doesn't necessarily translate to a bacterial infection that requires antibiotics. It can be viral. Sinusitis is inflammation of the sinuses. So the same thing that happens in the nose that causes the itchy eyes can also happen in the sinuses. So yes, it can be hereditary depending on what causes it. So if you try the simple treatments and it just doesn't work, or you now develop a fever and it's getting worse and you're having brownish, gunky things coming out from your nose, or most importantly, if you start to bleed or see blood, then that's a big no-no. These are the reasons to go and see your GP, because it now requires some other treatment. And Angela, remember we talked about there are different types of sinusitis. There's the acute one and there's the chronic one. So again, that's where that big bottle that Vanessa uses at home to squirt that fluid into her nose, you need to keep washing it out regularly, or else you're just going to continue reaccumulating. And that means you're going to continue to have that problem over and over and over again.
Thank you. And I think the issue of atopy and it being hereditary is really important, because people don't often think of it like that. It's important. It's all about sharing the knowledge within our families. So because you may be experiencing something, but you may not realize that your brother, sister, mother, grandmother has been experiencing it too. So, and that's the importance of sessions like this. And with the treatment, I think two things to pick up. So you mentioned about the antihistamines, and with the headaches, it's just reinforcing it. But is it just simple analgesia that you will take whilst the headache is there, in addition to the antihistamines?
Oh, yes. So simple paracetamol. Paracetamol is the safest medication you can ever take.
Right.
So paracetamol and rest, that's another thing unfortunately, people of Black and ethnic minority ethnicities don't do a lot of. We don't rest when we're unwell. So you may think, oh, it's just a simple hay fever, or just a simple cough, it's a simple cold. No, it's not that simple.
Yeah.
So the fact that you're pushing through it, even when you're that unwell, is what's going to intensify the headache. So stress, we know, is a common cause of headache, and infections is a common cause of headaches. So remember, we talked about the triggers, the things that make it worse. So rest is important. So simple paracetamol as well. And obviously staying well hydrated as well.
Great. No, that's so important, especially next week, everyone, with the increased temperatures that are coming. Hydration. Yeah. Definitely. And I think before I go on to some of the other questions, just highlighting what you said about the bleeding, and because again, in the same way, I find that many people don't rest from our communities. Often when we see things like blood or something, instead of it triggering, oh, we must go and see the doctor, we kind of wait for it to happen a number of times or to become more severe before we go. So if you could just comment about that in terms of presenting early, please.
Yeah, so there's something called the red flags. So the red flags is, everyone knows what a red flag is. If you see a red flag, it tells you there's an alarming thing. It shouldn't be there. It's not normal for it to be there. So you shouldn't be bleeding from your nose. So sometimes when you overblow or agitate the nose, you can bust a few vessels and it will bleed. But when you've got your blocked nose and let's say you have a huge amount of bleeding, and you have this discharge that is coming just from one nostril, it's not coming from both, but one nostril. These are what we call red flags, and you must get it checked out. It's always best to be told, oh, it's nothing to worry about, rather than sitting at home and letting it get worse and worse and worse. We know from the data published by the Macmillan UK, we know that unfortunately, the majority of the cancers that are picked up in people of ethnic minority communities are often picked up in emergency departments after he had been there for quite a long time. And they became so unwell that they turned up in A&E and he was picked up. So it's so important to know what is normal and what is not normal. But most importantly, if you don't understand it, if you don't know what to expect or what to look out for, then please keep tuning into sessions like this and know the number for your GP and just give them a call.
Thank you so much. Such important advice for us all, everyone on here to heed. So thank you. And just thanking Faye, because when talking about the triggers that you mentioned, I think she was just emphasizing cleaning products, disinfectant, bleach and seasonings can all kind of trigger some of those irritations. So for us not to forget that. So thank you as well, because it's sometimes the simple things around us that we are using day to day that can be a problem. So and again, please keep these questions coming in, because this is what makes the session so rich. And really appreciating all the comments coming through. And if people want to directly ask verbally, you have the opportunity to do that as well. But coming on to another question, so Marcia talks about, which I think another thing that I can definitely relate to, that mucus running down the back of the throat from the sinus, and then suddenly having a coughing fit and feeling very uncomfortable at the back of her throat. And so Marcia takes a specific antihistamine, so exotenadine, hydrochloride, but still gets itchy eyes, sore throats, and watery eyes on top of everything else. And so what do you suggest in your reflections on that? And just tying it in with someone else's comment to me about watering eyes. So as soon as they go out to the cold, their eyes water. Is there any suggestions for that? Thank you.
So the thing to bear in mind is that, you know, antihistamines, sometimes you may need to combine antihistamines. So if one is not working or one is not effective for you, there's no harm in combining them. So again, this is one of the things that you must discuss with your GP, because some antihistamines cause drowsiness, some don't cause drowsiness. So you don't want to be using the ones that cause drowsiness if you're an active person and you're driving and you need to get to places. So that's the first thing. And the other thing is, there's no harm in using an eye drop. If they say if the eyes are the issue, you can use eye drops to specifically target the eye symptoms while you're taking the oral medication to target everything else. Then the third thing I will also say is that there is a specific antihistamine nose spray that is known to be very effective for eye symptoms as well. So again, it's about knowing what am I doing now? What else can I do on top of it? And that's where, again, getting in touch with your GP just to ask the question. And some skin specialists actually double the antihistamines. They double the dose that you're on. And I have seen a few skin specialists take it up to 4 times the prescribed dose, but this has to be done under supervision by a doctor. So yes, so there's still a lot of room to maneuver with what you're doing currently.
Great, thank you.
And again, remember the triggers. Remember what I said before. There's no point pouring more medication onto something if you're constantly being exposed to the trigger of whatever it is that you're treating. So oftentimes eliminating and getting yourself away from that trigger is part of the treatment we're talking about.
Mm-hmm. Sorry, and so specifically, just thinking about the comments about watery eyes. Yes. So the antihistamines and manipulating them a bit, different types, etc., could make a real difference. Is there anything else specifically for the eyes that people could use?
So the thing to bear in mind, again, remember what I said in the beginning about the different causes of watery eyes. So sometimes when the tear duct is blocked, it causes the eye to water a lot. So watery eyes can be a symptom of dry eyes, and that requires a specific type of treatment that is not antihistamines. So that is why, bear in mind that the eyes watering is not synonymous with rhinitis and hay fever. There may be other things going on. So that is why it's important to get it checked out.
Great, thank you. And I'm loving that people are asking questions and sharing, because Angela's written that, as you've just mentioned, she wrote earlier that some antihistamines can cause drowsiness and affect your function. And so, and that's great. Thank you, Angela, because it's all about connecting and sharing our experiences as well. And so, another one of the questions is, and it's a really great question about smoking and being a passive smoker, and the impact of that. So one question from Ngozi is, can people be allergic to passive smoke? Like if their partner is a smoker in the house, but they don't smoke, what can be done about this?
What are your thoughts, Vanessa?
Well, not to cause relationship problems, but yes, I think that definitely you can be allergic as a passive smoker, and that's the whole thing about, I think, the term passive smoker, because you're there, but you're having symptoms and you're not having the experience of smoking.
Yeah, no, it's well documented, isn't it? It's well documented as smoke from whatever source, especially nicotine smoke, is a common aggravating factor or trigger for worsening asthma symptoms, rhinitis, all sorts of allergies, and the rest of it. And oftentimes, back in the day, we were told if you're not the one doing the smoking, you're fine. But we now know that just being exposed to it is enough to give you the same risk factors as the person smoking it. And the other thing to bear in mind is that oftentimes you get people who tell you, oh, but my partner or I smoke outside, I don't smoke in the house. That doesn't make any difference because the smoke particles stick to the clothes themselves. Remember the picture of the bee with the pollen all glued to it? That is what it does. It sticks to the clothes and it still causes the same issues. So yes, smoke, whatever form is a common trigger and should be avoided.
Great, thank you. And so really follow-on question from that, and I like it. So what does the partner do in that situation? This is
What you do, just have a chat. Have a chat, because as an educator, we're very there's something called the Johari's window, and the Johari's window, it's about how you can, work together with somebody, or try and find what works and what doesn't work. But most importantly is the unknown. You don't know what you don't know. So now that you're here and you've listened to this talk, we've talked about the risks of smoke, and the passive risk, the active risk. We haven't even talked about lung cancer, which we know is a big issue. We haven't even talked about chronic lung problems like COPD. There's also asthma. There's also the rhinitis. Just sit down and have a candid, open conversation with your partner, because they may well not know. So try and educate them. And if that still doesn't work, then it's again, how do you work it out together? Because obviously this session is not a counseling service. We're not here to tell you how to do things with your partner, but it's just about being aware that your health may be at risk. And oftentimes we need to take measures to protect ourselves before it's too late.
Mm-hmm. No, I really like that. And I like the fact of sometimes, we don't know what we don't know. So we may think that someone's behavior is intentional or selfish, but they may not know how it impacts you. They're just thinking of themselves, but not thinking that it has a knock-on effect. So yes, my favorite term, communication is key. It's a thing that can shape so many things in life. And another question, and I suppose reflection as well, is about healthy diet and lifestyle, and how that can impact rhinitis and other things that you've mentioned.
So yes, again, when we talk about allergens and atopy, there are some foods that cause allergies. So there are some foods that if you eat, I know some people can't eat tomatoes. Some people can touch eggs. Some people can't even touch milk or any dairy products. So once they do that, the whole body starts to age, the mouth swells up, the eyes start to age, the nose starts to water. These are all allergens. So again, there's no one advice that applies to everybody, because everybody is different. So it's about finding out what works for you and trying to stick to it, but also being aware that food can also cause allergies and can be a trigger. So if you find that at specific times when you eat specific foods that all of a sudden you're itchy, your eyes are watering, you're having to go and take antihistamines, ask yourself, what did I eat? And that's where we advise keeping a diary, so you see and be able to recognize whatever pattern there is.
No, thank you. And I think all that ties into your own self-care, because taking the time to rest, taking the time to actually think, what is affecting me, what is triggering it, is really important. And I think many people don't stop and do that, rushing around with life. And so when a doctor says, what do you think is contributing to it? You have no idea, because you haven't even had time to think about what's happening in your life. So no, such important insights today. And so I'm just want to throw out there to give people an opportunity that you're on the call here. If you want to speak, just speak up. You can put your hand up virtually or physically, and I can see it. Just an opportunity for you to talk directly, because yes, we don't take it lightly. I love it. Hands are going up instantly. So I
just wanted to add, Vanessa, that I don't think we look scary. You and I, do we look scary? We don't bite.
Yeah, exactly.
Axe away.
Exactly. I love that. We had two hands shoot up. So over to Angela. Thank you, Angela.
Okay, sorry, there was a delay in me being unable to unmute.
No problem.
Good morning, and thank you so much for the information so far. Just wanted to ask about allergy tests, though, because we've heard about allergies, but sometimes you don't actually know what it is that you're allergic to. So you keep experiencing these symptoms, and it could. I know it. I've heard you say about dust and whatever, but sometimes you don't know what it actually is attributable to. So how do you actually go about getting an allergy test? What does it consist of? And can you just go through that process? Because I know lots of people, especially during, obviously this weather is another thing, but generally I've heard people say, well, I'm allergic to cats, or I'm allergic to dogs, or I'm allergic to or I'm allergic to dust. But when it comes to kind of hay feverish type things, it's a bit different. So what is there a specific allergy test, or is it just a series of tests that people need to go through?
Well, what I would say is there are allergy tests and there are allergy clinics, and what they do is deal with trying to figure out what allergen one is exposed to. So there are quite a few, there are a plethora of tests that can be done. I know, again, it differs from where you are, because it depends on what service is available locally to you. But where I am, we can request a panel of blood tests. And this doesn't test for everything, but it just kind of gives an idea. Because we're not allergy specialists, we don't dabble into these things. So we usually, if it's a patient is struggling with their allergy, or just someone who has requested specifically for allergy tests, we usually can refer them to the allergy clinic. And that's where they're going to do a whole panel of tests, because oftentimes this tests need to be done in a controlled environment, because we're talking about itchy eyes, itchy nose, and all that. But some people can develop what we call anaphylactic reactions, which is life-threatening type of allergy response to certain allergens. So that is where the allergy clinic comes in, because it's done in a controlled environment where they have resuscitation kits and the rest of it, and the patient is monitored. So I would suggest speak to your GP to know what's available locally. Do you have anything to add, Vanessa?
No, I completely agree. And I think it is that communication with your GP for them to know that something is being triggered, something is happening. And then doing the diary, as you say, is fantastic because it makes you reflect. But as Angela says, a lot of the time you're not sure what it is. And so then that's where you hand it over to the GP, and then they can refer you to the right places. Revealing all my medical stuff here, but I'm very atopic. So I've had a number of allergy tests. And it's just really interesting because, when you do go for it, and there's different ways of doing it, but there's one where they trigger on your arm, and you see how big the reaction is, and things that you may not think are at all relevant actually pop up, and when you do stop being exposed to it, can make a huge difference to your symptoms. So yes, no, that's great. And we have Ngozi.
Thank you, Dr. Vanessa. Thank you, Dr. Nkolika. Just to go back to my question, I know you've said that you're not counselors, but I just wanted to say that it is really important for people to, have that discussion, because this happened to a very close relative. And unfortunately, the person who was a smoker is still alive, and the person who was a smoker has passed away. And I just suspect that a lot of those allergies and different things, complicated things. And just correct me if I'm wrong, did you say that some of this could probably affect lung cancer? Does it, I don't know, are they all related? That's one thing. And then just to also just plead with people, yes, it is the difficult conversation to have, but please do that, because it can affect you. And this is someone who was very close to me, and it wasn't a good outcome at all. Yeah, thank you.
Oh, Ngozi, I'm so sorry to hear that, and thank you for sharing this very, very personal story with us. And thank you for that. it is one of those sad things that oftentimes we because we're trying to keep someone else happy, we tolerate and endanger ourselves inadvertently. So that is again why this work that CAHN is doing is very, very laudable, because we need to raise that awareness and we need to empower. When we say empower means giving you that confidence to go back and say, listen, I've been to this talk, this is what they said, I feel we need to do these things differently. And you put your foot down. You don't need to have gone to medical school to be able to do these things. That is why we're here, to share our knowledge and to share our experience with you. So yes, Ngozi, I mentioned lung cancer, I mentioned chronic lung disease, which is COPD. Yes, we know that smoking and exposure to smoke, whether active or passive, is a contributory increased risk factor to the development of these diseases. But we also know that there are some people who never touched a cigarette and weren't even exposed to passive smoke who have ended up developing lung cancer. So that is why I said in the very beginning of this talk, you can never say never in medicine. So there are so many things that we read in medical books, but even up until now, almost 20 years as a doctor, I am still surprised every day. And it's one of those things that it's just all about being aware of what the risk factors are and how these things can affect us in one way or the other, and taking steps to protect yourself.
So true. And Ngozi as well, yes, just echoing the thanks for sharing that with us, because it is deeply personal. But as you said, Nkolika, it's about really resonating about why sessions like this are so important. And I know that all the organizations involved, the Health Hour is really dear to their hearts, because it is about getting that information out there and sharing with one another. So so thank you both for your responses there. Any other questions that people want to ask directly? You have the opportunity, so please do. I've got other questions coming through the chat, but you're really welcome to please ask directly and have that face-to-face, not face-to-face, virtual encounter. I have to say, in life now, we don't take interactions with GPs lightly. So we've got a GP right here, so use the opportunity. But Margaret highlights that she has hay fever that results in such severe rubbing of the eyes that then that has then, you know, what you were saying earlier, another knock-on effect of, and here it's pain and inflammation for about 3 weeks, and went to her great GP, gave antibiotics, but it hasn't helped, and just wondered if you had any advice for that at all.
So again, remember, please go back if the antibiotic hasn't worked. So it may well be that it's not the right antibiotic for that particular situation, because we know when we talk about antibiotics, there are different antibiotics for different bugs. And unfortunately, it's not always the same bug that causes the same problems. So it may well be that there's a different bug that requires a different antibiotic. So do not hesitate to go back and say, the antibiotic you gave me didn't work, because sometimes it may not be an infection. It may well be that you need to have another examination or have another reassessment and something else tried. But don't sit back now that you've had the antibiotics. What I tell my patients, I'm not sure what everyone else does, but what I tell my patients is, if you haven't noticed any improvement within 2 days of starting the antibiotics, come straight back.
I think what you've emphasized there is so important in terms of that relationship with your GP, and if something isn't working for you, going back. And Margaret says that she's been suggested steroids, but has been it wasn't very sure on that. I know you can't answer specifically, but just in terms of your experience of that.
Yeah, so like I said before, steroids is one of the medications that we use that can be used to treat this rhinitis or anything that has to do with allergies. But like I said, everybody's different. You may well be the steroids are not for you. It may well be that your medical history doesn't allow you to use steroids. So is one of those things that we would always tell you, go and speak to your GP so you get the treatment that is tailored for you. But in the list of resources that is at the back of this PowerPoint presentation is a link to the NHS website and also a link to Allergy UK website, because these also tell you the step-by-step as to what can be done and what you should do to help you manage these issues.
Great, thank you so much. There's been a suggestion of honey pre-hay fever season helping with the management of symptoms, and another question is reflection has come through about any other remedies, off-the-counter remedies that could work. So if you could comment on that. I know it's tricky.
I don't do herbal medications. I don't do that, and I can't comment on them, but we know that honey has medicinal properties to it, so we know that. So, but again, it's something that you can't just use because you've been told it works. So you've got to make sure that you speak to your GP to make sure it doesn't interact with any other medication that you're on, and to make sure that it's safe for you. And I also know that ginger, is it ginger and lemon? Is it ginger and honey? Yeah, it's good for cough, particularly cough. We know that. So these are natural remedies. But again, for anyone who's on any medication whatsoever, you've got to speak to your GP, because oftentimes these natural products or herbal remedies will interact with what you're on and cause issues. So we are always very, very careful to avoid giving blanket medical advice, because it is always very risky.
No, yeah, I think completely share that. I always say, similar to what you said, never say never. So when people come to me with suggestions of what they've been using, I say I can neither confirm nor deny. You know, if it's been something positive for you, then, but the key thing is that communication with your doctor to let them know, just in case there aren't any other interactions and things like that. So no, completely agree. And I just again want to thank you so much and thank the audience for the great questions. And we have a couple more minutes, and I've got a question to go through. But if please, hands up, virtually, physically, or in the chat if you want to. But just know we've only got a couple more minutes before we have to end this great session. So just a private message that has come through just about asthma. And rhinitis, but specifically asthma. So the person is saying that they've been told they are 35 and have been told that they now have asthma, and before they've just been told that it's rhinitis or some sinusitis, and now they've been told that they've developed asthma, and they've just said, is late onset asthma common, and could they have done anything to prevent it?
To be honest with you, like I said in the very beginning, I'm not a respiratory specialist, so I can only but tell you what I know. I'm not very familiar with how common late onset asthma is or how rare it is. I can't comment on that. But what I do know is, just again going back to what Ngozi shared, if you are constantly exposed to an allergen or a particular trigger, and again, remember what I shared from the NHS website and Allergy UK website, where it said that the reason why it's important to treat rhinitis, allergic rhinitis, is that it increases your risk factor, your risk of developing asthma. So it may well be that that's what's the case here. So if you're constantly exposed to a particular allergen, and if the rhinitis is not well treated and treated properly, it may well increase your risk of developing asthma down the line.
Great. That is incredibly helpful, and a good reminder of what you said earlier about the importance of managing the rhinitis and not just leaving it. Because I think that someone highlights about, how could asthma be reversed? Is that easier in children? And acknowledging what you say, that you're not a respiratory physician, but it's about picking up potential triggers and dealing with them. That's the thing that could limit that. So no, thank you so much. And one of I think the last question that I'll put forward is someone's put in that with their rhinitis, they've gotten control of it and they're very happy at the moment. Is it likely that it will come back?
Again, depending on what your trigger is. Remember, there are different types of rhinitis. There's the allergic one that can be a whole year round. So the pollens are plentiful in the atmosphere between March and September, but after September, there's a different type of pollen. There's a different type of allergen. So we're always exposed to one allergen or the other. So it's not uncommon that lots of people do struggle with it on a regular basis. But again, it's about knowing what to do to keep it under control.
Great, thank you. Oh, thank you so much. I think it's been a great session. We've had great feedback on the chat, and a real testament to how the clarity in your presentation and the engagement as well, which I think has worked really well. And I think rhinitis, sinusitis is something that affects many people. So lots of learning from today. And just to highlight that, as we've said, that if you've got any further questions or you'd like the slides, please do email health@CAHN.org.uk, because our colleagues that come on and speak not only prepare the slides in their own time and bring it to us, but also have made them accessible as well. So and they're good learning and a good resource to have at home. And I know that Ngozi may come on just after me just to highlight future events, but I just wanted to highlight that it was mentioned about healthy living and how that all impacts, and there is the Healthy Hearts session that's coming on that is about food allergies as well and how they can be prevented, so all tying in together. But I again want to thank everyone on the call for taking time out of your Saturday morning. We don't take it lightly, and I want to thank again Nkolika for your time and your sharing all your expertise. It's been a great morning. So thank you all, and I'm going to hand over, I believe, to Ngozi to close the session. Thank you.
Thank you, Vanessa. Thank you.
Thank you so much, Dr. Vanessa. Thank you, Dr. Nkolika. Really, really insightful session. I'm just going to run through our events for next week and a future. So next week's health hour would be around looking after yourself in old age, and Dr. Valentine Ngwa will be here with us next week. So please join us again next week. And then we have our Healthy Heart session on Tuesday. So like Dr. Vanessa had mentioned, and we put in the chat box, is about food allergies. So join us on Tuesday, 19th of July from 6 p.m. to 7:30. So for a very insightful session with our guest speaker. Thank you for that. And then we have our services, which is, we've got various services: family advocacy, our counseling services, and domestic violence. Feel free to call 07710-022-382 anytime between 9 a.m. and 9 p.m. We're here to help you. And I'll just run through our partners. So where some of you have joined from different regions, we sent out a survey and we can see that people have joined from different regions. So CAHN, we are one of the partners. So yeah, do get in touch and join us. We've got our next partner, the Black Health Initiative. So if they're around your area, please get in touch with them and see how you can get involved with Health Hour. Our next partner is the Croydon BME Forum. So if you're around the Croydon area, that region, please do get in touch with them and join and see how you can help as well. Next partner is our Enfield Caribbean Association. We have a lot of links with Enfield. So if you're around Enfield and the London area, please get in touch and join the session. We also have our partner, the Royal Assembly Redeemed Christian Church of God in Sheffield. So please feel free, those around there, Doncaster area, all of that, get in touch with them and join our session. Thank you. And last but not the least, we've got our RAFA International Development Agency. They're in Birmingham. So Birmingham is a massive area. So please get people on board in your area, join us and get in touch with RAFA. So we thank you once again for your time today, and we look forward to seeing you on Tuesday for our Healthy Hearts and next week again. Thank you. Have a lovely afternoon. Bye, everyone. Thank you.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.